afternoon. My name's Arielle. I'm a nurse that's going to be doing a quick assessment on you this afternoon. Can I ask your name?
London.
And Miss London, what brings us to you this afternoon?
I've been having headaches and I think they're associated with my period.
You think so? Okay, well we'll check that out and see what's going on. Can I get your age, please?
17.
17. Okay. And what is your current occupation, Miss London?
I'm a student.
Okay, sounds good. So you said your chief complaint is that you have headaches and they're usually brought on by your period?
Mm-hmm.
Okay. How is this affecting your daily life?
I'll have to stop whatever I'm doing whenever I get the headache and go lay down in the dark room.
Okay. Do you have any current medications that you take?
Thyroid and orthotriceptin.
Okay, so you have a history of hypothyroidism.
Mm-hmm.
Okay. Do you have any current allergies?
Just hay fever.
Alright. Do you have any smoking habits?
No.
Do you drink any alcohol? Alright. Do you have any childhood illnesses that we should know about? Do you have any family history?
Diabetes and heart problems.
And who in your family has that?
My father.
Does your mother have any problems that you know about? What about your brother or sister?
No.
Alright, sounds good. What is your current educational level?
High school.
Do you have any lifestyle issues that we need to know about?
No.
Okay. Alright, now what I'm going to do today is I'm going to do a focus assessment on your neurological system so we can maybe get a broader idea of what's going on with these headaches. It's just going to be checking to see if everything else going on with your neurological system is okay, nothing you really need to worry about. So I'm just going to tell you a little bit about what we're going to be doing. I'm going to be performing an assessment on your mental status, which is just going to be me asking you some questions. I'm going to do an exam on your cranial nerves, which there's 12 of them, and it involves different tests. It'll go from facial movements to eye movements to certain reflexes. I'm also going to assess the motor system. That's just going to be how well your muscles react to resistance. I'm going to have you walk around the exam room a little bit, and we're just going to test to see your gait. We're also going to check your senses, and we're also going to take a look at your reflexes. Sound good? If at all during this assessment you have any questions for me, stop me and I'll be happy to answer them for you, okay? Alright, I'm going to start by taking a little bit of a health history. For these headaches, where exactly do they occur?
Not right here.
Right there. Do you have any referred pain, like to your back, your neck, your shoulders? Okay, so they're just limited to this area of the head. About how long do they last?
An hour and a half.
Okay. Do you have any of these associated signs and symptoms? Double vision, weakness, loss of consciousness, any dizziness? Okay. Do any of these make it worse? Coughing, sneezing, any sudden head movements, stress, bright lights, menstrual cycle?
Okay. Oh, yeah.
Yeah, okay. Do you have anything that makes it feel better, such as medications?
I'll take some Tylenol and help a little bit.
It'll help a little bit? Okay. What about rest? Alright, and you said earlier that you have to lay down in a dark room and that usually helps relieve it. Okay. In general, have you had any issues with dizziness, vertigo, or fainting? Okay. What about weakness? Any loss of sensation? Okay. What about, do you have a history of seizures or tremors?
No.
Alright, sounds good. Does anybody in your family have a history of that? Okay. Alright, well we're going to start the assessment. I'm first going to assess your mental status. I'm just going to ask you a couple questions, okay? Can you tell me your birth date?
11/29/1996.
Where do you go to high school at?
The Rolls Tour School.
Do you know what day it is today?
The 7th.
And do you know who the President of the United States is?
Barack Obama.
Okay, you are oriented to date, person, place, and time. And I can tell you know who you are. Alright, next we're going to start by assessing the cranial nerves. Now what I'm going to do, I'm going to explain to you each test for the cranial nerves as I go through them, okay? The first cranial nerve that we're going to be assessing is the olfactory sense, which is your nose, your sense of smell. So what I'm going to do is I'm going to ask you to hold one of your nostrils closed. I'm going to hold this jar underneath and I want you to tell me what you smell. What does that smell?
Hot chocolate powder.
Okay. Can you do it with the same note? Alright, what do you smell?
Hot chocolate powder.
Great. Your olfactory senses are intact. You can smell, and it is hot chocolate powder that is in this jar. Alright, the next test that we're going to do is I'm going to take a look at your eyes. I'm going to assess your vision. I'm also going to assess your ocular motor movements, meaning that can your eyes move in all the directions that I've asked them to. Alright, there's a chart at the end of the exam, the Snellen chart. Same chart that's in the eye doctor's office. Could you cover your right eye, please? Read to me the first line of the Snellen chart.
E, B, Z, L, Y.
Awesome. Can you cover your left eye?
E, B, Z, L, Y.
Very good. You have perfect 20/20 vision in each eye. Very wonderful. Alright, now what I'm going to do is I'm going to assess your pupillary response. I'm just going to shine a pen light in your eye, okay? That's just going to check to see if your pupil shrinks whenever I shine this light in this eye, okay? What I'm going to ask you to do is look over my shoulder. Do not stare directly into the light. I'm going to shine it back and forth in the eye, in each eye twice. Very good. Pupils are equal and reactive to light. The pupils are the same in size and diameter. Everything's looking good so far. Alright, what I'm going to do is I'm now going to test to see your ocular motor movements, okay? Now what I want you to do is I'm going to hold this pen line. I want you to follow with just your eyes. Do not move your head. Okay? Going in different directions. Everything's looking good. She's following the movements appropriately. Alright, very good. Your ocular motor senses are intact so far. Everything's looking good. You were able to follow my pen light in each direction. You didn't move your head. Alright, now I'm going to test convergence. Now what this is going to do is I'm going to move this pen light to your nose. I want you to follow with just your eyes like you just did. It's going to basically make it look like your eyes are crossed. Alright. Alright, we have perfect convergence. Very, very good. Alright, now what we're going to do is I'm going to test your corneal reflex, okay? All I'm going to do is take this little cotton ball, I'm going to touch it to the side of your eye. It should make you blink and shy away from it. That'll mean that your corneal reflex is intact. Okay? Alright, there we go. Now the right eye. Open your eye a little more for me, please. Thank you. There we go. Perfect. Corneal reflexes are intact. Alright, now I'm also going to assess part of assessing your corneal reflexes, which is part of the trigeminal nerve. I'm also going to assess your jaw muscles. I need you to clench your teeth for me. And I'm just going to palpate your jaw muscles, okay? Tell me afterwards if this hurts at all. Okay, very good. Did that hurt? Okay, good. Jaw muscles feel good. Alright, now what I'm going to do is test the facial cranial nerve. All this is going to be is just having you move different parts of your face. Can you raise your eyebrows for me? Okay. Can you blink? Alright, can you smile for me? Alright, can you frown? Puff out your cheeks for me. Alright. Both sides of your face are symmetrical when you move them. Smile, everything looked very symmetrical. Movements are symmetrical. And the strength in them was symmetrical as well. Everything's looking good. Alright, the next thing I'm going to test is I'm going to test your gag reflex, your vagus nerve. What I'm going to need you to do is I'm going to need you to stick out your tongue. Shine this in there so I can take a good look. And I want you to say, ah. Alright, I'm going to stick this tongue back in there. Okay, there we go. I heard that gag reflex. Perfect. Perfect, perfect. Everything's looking good. Okay. Next cranial nerve I'm going to check is the spinal accessory. Okay? I'm going to put my hands on your shoulder and I want you to shrug. Very good. Alright, last one I'm going to test your hypoglossal. Stick out your tongue for me. Move from side to side. Very good. Alright, now we're going to move on to the motor. We're going to test your strength and your muscles and have you walk across the exam room. Okay? First we're going to have you sitting down there. Alright, can you hold up your hands for me? Alright, hold them like this. Try and pull. Okay, very good. Alright, hold your hands up like this. Try and push me. Very, very good. Very good. Okay, we're going to test your grip now. Can you hold my hand, please? Squeeze as hard as you can. Very good. Do it with this hand. Very good. Strength is equal bilaterally. Alright, now we're going to make a fist. Alright, try and resist me. Very good. Same here. Resist me. Very good. Strength is equal bilaterally. Alright. Now I need you to spread your fingers for me in both your hands. Prevent me from moving your fingers. Equal bilaterally. Very good. Alright, now I'm gonna have you lay across the exam table. We're gonna check the abduction and adduction of your hips, okay? Alright. I'm gonna try and push your legs apart. Do resistance. Very good. Alright, I'm gonna try and bring your legs together. Resist me. Very good. Equal. Equal in both extremities. Very good. Alright. I'm gonna lift your knee up. I want you to try and prevent me from bringing your leg down to the exam table. Very good. Alright. Do the same with this leg. Alright. Equal in both extremities. Now what we're going to do is test the ankles. Resist me from pushing. Very good. Equal in both ankles. Everything's intact so far. Alright. Now what we're going to do is, could you sit up for me? Alright. I'm going to ask you to walk up and down the exam room right here. Very good. Gait is normal. Alright, can you do the same for me now, walking on your tiptoes? Alright, gait is normal. There doesn't seem to be any problems with your gait. You don't have any loss of consciousness. You're not experiencing a wobbliness or weakness. Gait looks very good. Now what I need you to do is we're going to test your fine motor skills and your coordination a little bit. Okay? I'm going to hold up my finger. Touch it with your finger, then bring it to your nose. Alright, keep doing that. Do it quicker. Very good. Next thing I need you to do is I need you to touch your index finger to your thumb. Start slowly, then move quickly. Very good. Do it with the other hand for me. Alright, coordination's looking extremely good. For now, you are looking extremely good. Assessment's going good. You have a 5, which is normal in muscle strength. Alright. Now we're going to test the sensory system. What I want to do is take this wisp of cotton and touch it to different parts of your body. I want you to close your eyes and tell me what body part I'm touching it to.
Forehead, chin, upper left thigh, my right hand, my right foot.
Very good. All sensory systems are intact. You can feel the cotton ball in all your extremities. Alright. Now what I'm going to do is I'm going to ask you to hold out your hands. I'm going to draw a number on it. I want you to tell me what the number is.
3, 7.
Perfect. Senses are intact. Alright, last thing we're going to take a look at are your reflexes. And this is going to be me checking your elbow, your knee, and your Achilles tendon reflexes. Alright, now what I'm going to do is just beat on it with my little hammer, and we're going to see if your reflexes are happening, okay? Just let yourself dangle for me. There we go. Left elbow intact. Right elbow intact. Alright, now I'm going to move on to your knees. Left knee intact. Right knee intact. Those are your patellar reflexes, so they're both intact. Lastly, we're going to be checking the Achilles tendon reflexes, okay? Left is intact. Right is intact. Very good. Last thing I'm going to be doing is I'm going to take this key on the back of my badge and I'm going to stroke it on the bottom of your foot. Alright, could you just lay on the exam table for me? Alright. And this is just going to check to see if you feel it, okay? There we go, yep. By your big toes removing in that response, that means that your plantar response is intact. Alright, you can sit up for me, Ms. London. Alright, well, my assessment shows that everything neurologically is intact. I'm going to let the doctor know about my findings, and we're going to talk more about those headaches and everything. Right now, everything seems neurologically intact and okay. But what we're going to do is just try and get some pain relief for those headaches I know they're bothering you. Thank you again for meeting with us today.
Thank you.